A pharmacy is an establishment that has professionals who administer drugs based on prescriptions given by a medical doctor, while patent medicine vendors may not necessarily have professional training but sell over-the-counter drugs.
Patent and proprietary medicine vendors. One of the main aims of establishing some of these health institutions is to help ease the access of medicine to the public. However, there are so many benefits of these things as well as implications or disadvantages. The essence of constituting or allowing for the medicine stores, as it were, or medicine vendors, is so that people can have access to drugs that you do not necessarily need a prescription from a doctor to have them.
A medicine vendor also speaks on the development.
We are not selling the drugs without prescription. You cannot come and tell us to give you some drugs without prescription and give you. We can't do that here.
We speak to some Nigerians in Gombe State on their preferred point of accessing medicine, hospital, pharmacy, or patent medicine.
When you are feeling like headache, you will prepare to go to chemist because you know headache, whenever you take paracetamol or other pain relievers, it will be okay for you. This is one of the reasons why I go to chemist whenever I'm feeling slight. Maybe I'm a little bit stressed up.
I used to go to hospital whenever I am sick, and I prefer a primary healthcare center. I get better services there than a big hospital. From the testimonies of these respondents, many Nigerians preferred accessing medicine at patent medicine or drug vendors. Dr. Dangana said many people preferred medicine vendors than hospital for financial reasons, despite the consequences involved.
It's very possible for you to have a problem that does not need antibiotics, and then you go over the counter and you go to them and say, I want augmentin, I want amoxicillin, I want erythromycin, I want whatever, and then they will dispense these drugs to you. Now, when you don't need those drugs and you take them, you are creating a situation whereby in the future we're going to have a problem with resistance. Not to talk about the side effect of these drugs on you. What about the issue of dosages for children and for adults?
Dr. Dangana called on the federal government to provide health insurance services to all Nigerians through universal health coverage to discourage people from consuming drugs obtained without prescription from medical professionals. From Gombe, Ibrahim Ismail reporting for Trust TV.